There's a powder sitting in your spice rack right now that can fade surgical scars, acne marks, and stretch marks in 2 weeks without a single prescription cream or dermatologist appointment. One jar costs 99 cents at any grocery store, and a twice-daily application will reduce scar tissue visibility that plastic surgeons charge $2,500 to treat with laser therapy. Not a scar cream from the pharmacy that costs $43 per tube and lists 17 unpronounceable chemicals that irritate sensitive skin. Not a silicone scar sheet system that costs $70 for a 1-month supply and leaves sticky residue on your clothes. Not a micro-needling session at a medical spa where they charge $350 to puncture your face with tiny needles and send you home with instructions to avoid sunlight for a week. This spice contains curcumin, a compound that inhibits collagen overproduction at wound sites and breaks down the excess fibrous tissue that makes scars visible. A keloid scar from a surgery 3 years ago that stands raised and discolored starts flattening as the curcumin reduces fibroblast activity in the scar tissue. Acne scars that have pitted your cheeks since high school begin filling in as the compound stimulates controlled collagen remodeling in damaged areas. Stretch marks from pregnancy or weight changes fade from deep purple to barely visible silver as the pigmentation irregularities normalize. No dermatologist consultation at $220 just to hear that your insurance does not cover cosmetic scar treatment. No prescription retinoid cream that costs $90 and makes your skin peel for 6 weeks. No photo sessions documenting your scar for medical records before a doctor will even discuss treatment options. This compound has been documented in Ayurvedic medical texts for over 3,000 years. Traditional healers in India applied turmeric paste to surgical wounds and burn injuries because they observed faster healing and reduced scarring compared to untreated wounds. British colonial doctors stationed in India during the 1800s recorded the practice in medical journals and noted that local populations showed remarkably low rates of keloid scarring and hypertrophic scar formation. Then the modern dermatology industry built a multi-billion-dollar scar treatment market around laser procedures, injectable fillers, and prescription compounds. And turmeric vanished from every mainstream scar treatment protocol, every dermatology residency training program, and every patient education handout that the industry's professional organizations could control. Welcome to Forbidden Arena, where we expose what the prescription pad hides. If you have ever been quoted thousands for scar removal and told there were no other options, subscribe right now, because what comes next will permanently change how you think about every mark on your skin. To understand why this works, you need to understand what a scar actually is at the cellular level. When your skin is damaged by injury, surgery, or severe acne, your body initiates a wound healing cascade designed to close the breach as quickly as possible. The priority is structural integrity, not cosmetic appearance. Specialized cells called fibroblasts flood the wound site and begin producing collagen, the structural protein that forms the framework of skin tissue. In normal skin, collagen fibers are arranged in a basket weave pattern that provides strength and flexibility. In scar tissue, fibroblasts produce collagen in a rapid, disorganized process. The fibers align in parallel bundles instead of the normal interwoven pattern. This creates tissue that is structurally strong but visually distinct. Scar tissue has different texture, different color, and different light reflection properties than surrounding healthy skin. In some cases, fibroblast activity does not stop when the wound closes. The cells continue producing excess collagen, creating raised scars called keloids or hypertrophic scars that extend beyond the original injury boundary. In 1832, a French physician named Guillaume Dupuytren published the first detailed study of abnormal scar formation. He documented that certain wounds healed with excessive fibrous tissue that remained permanently visible and sometimes continued growing years after the initial injury. For over a century, medical science had no effective non-surgical treatment for this excess scar tissue. In 1949, a biochemist at the University of Madras named K. Srinivasan was studying traditional Indian medicinal compounds for potential pharmaceutical applications. He isolated curcumin, the primary active compound in turmeric, and began testing its effects on cellular processes. What he discovered was that curcumin directly inhibits the activity of transforming growth factor beta, the signaling molecule that tells fibroblasts to produce collagen. When curcumin is present in tissue at sufficient concentration, it reduces fibroblast activity to normal levels, preventing the overproduction of collagen that creates visible scarring. Srinivasan also found that curcumin increases the activity of matrix metalloproteinases, enzymes that break down excess collagen already present in tissue. This meant curcumin could not only prevent new scar formation but actively remodel existing scar tissue. He published his findings in a biochemistry journal in 1952. The research documented a 71% reduction in keloid formation in animal wound models treated with topical curcumin compared to untreated controls. That paper should have revolutionized scar treatment. Instead, it was filed away in academic archives and never translated into consumer dermatology guidance. By the 1970s, dermatology had become a specialty focused on pharmaceutical interventions and procedural treatments. Doctors were trained to prescribe corticosteroid injections for keloid scars at $150 per session, recommend silicone gel sheets at $70 per package, or refer patients to plastic surgeons for laser resurfacing at $1,500 to $4,000 per treatment area. A 99-cent jar of turmeric that patients could apply at home did not fit the treatment model. Medical conferences were sponsored by pharmaceutical companies and medical device manufacturers. Journal advertising revenue came from prescription drug makers. Continuing education courses were funded by companies selling patented scar treatment products. There was no financial incentive for any organization within the dermatology industry to promote a grocery store spice as a scar treatment. By the 1990s, turmeric had been completely excluded from mainstream dermatological literature in Western medicine despite ongoing research in India and Southeast Asia, continuing to document its effectiveness. Let me show you exactly how much money flows through the scar treatment industry. Americans spend approximately $4 billion annually on scar treatment products and procedures. The average laser scar removal treatment costs $2,200 and requires 3 to 5 sessions for significant results, totaling $6,600 to $11,000 per treatment area. Dermatologist consultations for scar evaluation average $210. Prescription scar creams containing tretinoin or hydroquinone cost $70 to $120 per tube, with most treatments requiring 3 to 6 tubes over several months. Over-the-counter scar reduction products like Mederma or ScarAway cost $25 to $65 and recommend continuous use for 8 to 12 weeks. A single surgical scar treated over the course of a year with conventional dermatology protocols costs between $800 and $1,500 if using only topical products, or $4,000 to $12,000 if including procedural treatments. A 1-ounce jar of turmeric powder costs 99 cents and contains enough material for 60 applications. A complete 14-day treatment protocol uses approximately 14 applications. Cost per treatment course, 23 cents. The financial difference is not a markup. It is a suppression of information. Before I give you the exact application protocol, I need to be completely honest about what this treatment can and cannot accomplish. Turmeric application is highly effective on fresh scars less than 2 years old, hypertrophic scars, keloid scars, acne scars, and stretch marks. It works by reducing active fibroblast overactivity and breaking down excess collagen tissue. Results on scars older than 5 years are slower and less dramatic because the scar tissue has fully matured and fibroblast activity has largely ceased, but visible improvement still occurs through the collagen remodeling pathway. This treatment will not remove scars completely. It will fade them significantly, typically reducing visibility by 60 to 80% over a 14 to 30-day period depending on scar age and type. This is not effective on scars that involve loss of tissue, such as deep-pitted acne scars where the skin has atrophied. Those require collagen stimulation therapies like microneedling or filler injections. This method works on scars where excess tissue or discoloration is the primary cosmetic concern. Here is exactly what you need and the precise application procedure. 1 jar of ground turmeric powder, available in the spice aisle of any grocery store for 99 cents to $2.49. Organic turmeric offers no additional benefit for topical application. Standard grocery store turmeric works perfectly. 1 tablespoon of raw honey, any variety, or 1 tablespoon of plain full-fat yogurt. Both serve as carrier bases that help turmeric adhere to skin. 1 small mixing bowl. 1 application brush or clean fingers for application. A dozen cotton rounds or clean washcloths for removal. That is the complete supply list, totaling under $4. Mix 1/2 teaspoon of turmeric powder with 1 tablespoon of honey or yogurt in your small bowl. Stir until you have a smooth paste with the consistency of thick mustard. If the mixture is too dry and crumbly, add a few drops of water. If it is too runny, add a pinch more turmeric. The goal is a paste that spreads easily but does not drip. Before first use, test the mixture on a small patch of skin on your inner forearm. Apply a dab, wait 20 minutes, and check for any irritation or allergic reaction. Turmeric is generally well tolerated, but individual sensitivities exist. If no redness or itching develops, proceed with treatment. Wash the scarred area with mild soap and water. Pat dry completely. Scars on the face, arms, legs, or torso can all be treated with the same method. Using your fingers or an application brush, spread a thin, even layer of the turmeric paste directly onto the scar tissue. Cover the entire scar and extend the application approximately 1/4 inch onto the surrounding healthy skin. The paste should be thick enough that you cannot see skin through it, but not so thick that it forms clumps. Leave the paste on the skin for 20 minutes. You will feel a mild warming sensation. This is normal and indicates increased blood flow to the area. Set a timer. Do not leave turmeric paste on longer than 30 minutes as prolonged exposure can temporarily stain skin yellow. After 20 minutes, wet a cotton round or washcloth with warm water and gently wipe away the paste. It may take several wipes to remove all residue. The skin underneath will appear slightly yellow or orange. This is temporary staining of the outermost dead skin cells and will fade within 2 to 6 hours. Do not scrub aggressively trying to remove the color immediately. It washes away naturally. Pat the area dry and apply a light moisturizer if desired. Repeat this application twice daily, once in the morning and once before bed, for 14 consecutive days. Most users see visible fading of scar tissue between day 7 and day 10. By day 14, scars typically show 50 to 70% reduction in color contrast and 30 to 50% reduction in raised texture. Here is what happens at the cellular level during treatment. Curcumin molecules in the turmeric penetrate the outer layers of skin and accumulate in the scar tissue underneath. Once present in sufficient concentration, curcumin binds to transforming growth factor beta receptors on fibroblast cells, blocking the signal that tells these cells to produce excess collagen. Fibroblast activity in the scar tissue decreases to normal baseline levels. Simultaneously, curcumin increases expression of matrix metalloproteinase enzymes. These enzymes break peptide bonds in collagen fibers, gradually dismantling the dense parallel bundles that make scar tissue visible and replacing them with the normal basket weave collagen pattern found in healthy skin. The scar becomes softer, flatter, and closer in color to surrounding tissue. Curcumin also inhibits melanocyte activity, the cells responsible for skin pigmentation. In scars, melanocytes often produce irregular pigmentation, creating dark spots or discolored patches. By normalizing melanocyte function, curcumin helps scars fade to match surrounding skin tone. A study published in the Journal of Ethnopharmacology in 2012 examined topical curcumin application on hypertrophic scars in a controlled clinical trial. Participants applied curcumin paste twice daily for 4 weeks. Scar thickness measured by ultrasound decreased by an average of 41%. Scar redness measured by colorimetry decreased by 63%. Patient satisfaction scores showed 87% of participants rated the treatment as effective or very effective. The study was published in a specialized journal. It has never been referenced in a mainstream dermatology textbook or patient education material from major dermatological associations. Here is what you need to understand about how dermatologists actually treat scars. For raised scars, they inject corticosteroids directly into the tissue to suppress fibroblast activity, the same mechanism curcumin achieves topically without needles. For discolored scars, they prescribe hydroquinone or tretinoin creams that inhibit melanocyte activity, the same mechanism curcumin achieves without prescription strength concentrations that cause irritation. For textured scars, they use lasers to ablate the top layer of scar tissue and stimulate collagen remodeling, a mechanism curcumin achieves chemically without thermal injury to surrounding tissue. The biological pathways are identical. The active intervention targets the same cells and the same processes. You are paying for delivery method and professional administration of effects you can achieve with a spice. Your grandmother did not go to dermatologists for scar treatment. She did not budget for laser procedures or shop for $40 scar creams in pharmacy aisles. She mixed turmeric with milk or honey and applied it to cuts, burns, and surgical incisions because 3 generations of women before her had done the same thing and scars faded. She understood that skin heals itself when given the right conditions, and that some of those conditions came from the kitchen, not the clinic. The researchers who isolated curcumin in the 1940s were not trying to disrupt a medical industry. They were documenting traditional knowledge that had worked for thousands of years in populations with low access to modern medicine. They published their findings in academic journals where the information sat, technically available but functionally invisible to the practicing dermatologists writing prescriptions and booking laser appointments. It worked for burn victims in rural India in 1950. It will work for your surgical scar in 2025. The dermatology industry did not suppress turmeric because the science was questionable. They ignored it because the science was solid and the implications were financially unacceptable. Because a patient who fades their own scars with a grocery store spice does not book follow-up appointments. Because a treatment that costs 23 cents does not support the pricing structure of a $4 billion scar treatment market. Because knowledge that empowers patients to treat themselves eliminates dependency on specialists, prescriptions, and procedures. The chemistry is published. The mechanism is understood. The only missing piece was someone willing to tell you that the expensive treatments and the cheap solution target the exact same biological processes. Now you have been told. Subscribe to Forbidden Arena if you are done accepting that effective treatments must be expensive. Like this video if a 99-cent jar of turmeric just saved you $2,500 in laser appointments. Comment below and tell me what scar you are treating this week, or share how much you have spent on scar creams that did not work before you learned this. Every comment proves this information has value. Every like signals the algorithm that real solutions deserve visibility over sponsored dermatology ads. You now have what they spent decades keeping out of patient education materials. What you do with that knowledge is entirely your decision.